returning to fitness after cesarean birth can be pretty daunting. We've had major abdominal surgery, and usually there's fairly little guidance on what to even do. So there's two things that we can do to help us return to fitness after C-section. The first is going to be scar mobilization. So with your incision here in your lower abdomen, sometimes the tissues around the incision site can begin to adhere or stick to one another. So as our fascia layer is healing, it gets really sticky. And then sometimes the connective tissue can be very disorganized. And so because of that, it almost causes this like pulling sensation to the front, which can make things like hip extension or extending in your leg very painful. It can also contribute towards lower back pain, some bladder issues. If the uterine scar is adhering to your bladder, it can cause pain with deep penetration during sexual intercourse. And so there's a lot of things that our scar can interfere with. And when it comes to fitness, it can affect how our core can stabilize. So during the first few weeks after your cesarean birth, we can start with scar desensitization, where we're taking different fabrics to first touch around the incision site. This can help to reset the neurological connection between our C-section incision to the rest of our body. We can then eventually move on to the actual incision site closer to when the outside of the scar is actually healed. And then at that point, we begin to do mobilization around the incision. When we do mobilization, we're going to start first with just moving the tissue around superficially, so just moving the skin around. And working with a pellet floor physical therapist can be really helpful when it comes to doing scar mobilization. We do offer an online course and a live webinar with a physical therapist to go over how to generally approach scar mobilization, but we are big fans of working with somebody in person as well. Something that we can do to help reconnect with our core after a C-section is we can focus on the myofascial slings. So myofascial slings are different chains of muscles and tissue and fascia that work together to achieve movement. The one across the front is the anterior oblique sling that goes from the chest to the obliques, crosses the front of the pelvis into the opposite inner thigh or adductor. And so you can see where your C-section incision is pretty much severing the sling right across the front of the pelvis. And so a lot of our C-section clients will say that they feel really disconnected from their core or disconnected from their upper to their lower body. And so what we can focus on after we've had a C-section, when we return to fitness approximately around 6 to 10 weeks, is we can focus on cross-body movements that target reconnecting this sling. So movements that are going to be involving the chest or the obliques with that opposite adductor. So typically we want to think movements that are coming to or rotating to midline are going to help to kind of reconnect within the sling. And so we'll show a few movements that we like to do to help our C-section clients feel more connected after they've had a cesarean birth. And these are the exercises that we incorporate within our 16-week C-section recovery program. So the first exercise that we can look to incorporate within our programming is going to be the opposite knee press. So we really want to be focusing on these cross-body movements. So you can start in a supine position with the hips down on the ground, and you're going to take one hand and you're going to press it into the opposite knee. So I like to begin with an exhale to lift up in my pelvic floor, almost think like pull my hip bones closer together, and then initiate the movement. So by exhaling first, we're ensuring that the core is beginning to stabilize, and then we can initiate this movement. So from here, I'm going to think exhale, I'm thinking lift up in my pelvic floor, pull my hip bones close together, almost zipper up the center of my belly. And then I'm going to press my hand into my opposite knee and hold. So I'm going to exhale, and then switch sides, or if you want to make it easier, you can just repeat on the same sides. When we alternate sides, it makes it a little bit more challenging. So exhale, and press. Hold, and I'm really thinking drive my knee up as I press down at the same time. So what this is doing is this chest and oblique is crossing the pubic symphysis to that inner thigh, and they're reconnecting across this sling. Now, if I want to make this more challenging, I can elevate the hips, so this is going to decrease the stability, and it's the same thing. I'm going to think put weight into this leg as I lift up to press into that opposite knee. And so this is just making it a little bit more challenging than before. Now, eventually we do want to get up off the floor and begin to progress movements to be more upright, because this is how we live our lives. We live our lives on our feet. And so ways that we can do that is we can take a Pilates ball, place it between the thighs. So this is going to help me turn on those inner thighs. And then I can have lateral resistance. And so this is going to incorporate the obliques. And so I'm going to bring the band to the center of my chest. I'm going to squeeze that ball and then exhale to push the band straight out. And I'm resisting a pull towards that point of attachment. So inhale, come back in, release the squeeze on the ball, and then exhale. So in this extended position, I'm really feeling the obliques really turning on. I'm feeling those inner thighs turning on, and this is going to be the beginning of reconnecting in an upright position. Now, if I want to make this a little bit more challenging, I can begin to incorporate a rotation to this. So I could stagger my legs, so this adductor will be my focus. I have the band in midline. I'm going to exhale to push straight out and then rotate away. So similar like we talked about before, anterior oblique sling is that chest is moving closer to that opposite knee. So we're rotating to the front of the body. So I'm here, I'm going to exhale, and then rotate away to really emphasize activation of that sling, and then inhale, come back to center. And so eventually we do want to progress our movements from the floor to an upright position, because this is how we live our lives, and this is how we're really going to begin to reconnect after we have a cesarean birth. So after cesarean birth, you may have received fairly little guidance on what to even do in regards to returning to fitness. The first thing that we can do is we can approach reconnecting with our incision site. So scar desensitization and mobilization are two tools that we can do to help reconnect the neuromuscular reconnection to the incision site. So if you're having numbness or sensitivity, those are both things that can really benefit from mobilization. If you're having different types of pain with hip extension, low back pain, or bladder issues, those can all be connected to your scar as well. Then we can incorporate cross-body movements to help us reconnect this anterior oblique sling, so the chest oblique crossing the front of the pelvis into that opposite inner thigh that was severed during a cesarean birth. And so we can help reconnect the core, reconnect the upper body with the lower body by focusing on exercises that emphasize the anterior oblique sling. So we can start with movements that are a little bit more chest to the front by activating the inner thigh with the obliques with like a Pallof press, and then eventually progressing to more rotational movements, which are really going to turn on the anterior oblique sling. If you want to learn more, you can learn in our scar mobilization course, which is self-paced, and we also offer a live webinar every other month with a physical therapist. And then we have our 16-week C-section return to fitness program that can help you get back to lifting again after your birth.